Body Beautiful. We're talking about neck lift surgery with Dr. Lee. First, let me remind you that we'll be taking your calls live with your questions. The phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice you hear on this show today, you certainly want to consult your own physician as well. Let's go to the phone lines. Let's take Michael from Sunnyvale. Good morning, Michael.
Good morning. How you doing?
Hey, I'm great. You have a question for Dr. Lee?
Yeah, I do.
Yeah.
So I'm 21 years old, and over the last 2 years, I gained 40 pounds.
Okay.
I was wondering if exercise itself will help me out, or would I need a neck surgery?
So you've gained weight and you've lost it again, or you've gained weight now? And it.
I gained weight before, you know. So like now I'm a little heavier, 180 pounds. I used to weigh 140.
Right. Well, I think that when you reach the weight at which you're comfortable and where you think you're supposed to be, you should see what you have in terms of excess fat in the neck, loose skin, and wait about a year from the time your weight is stable for things to settle down. You might not need a whole neck lift. You might be somebody who's appropriate for just liposuction under the neck. But it's really important that before you make any surgical decisions, that you are at a stable weight for at least a year.
Yeah, and Michael, it sounds like you have age on your side, 21. That skin's probably going to spring back
well
all on its own. And you know, speaking of that, the picture that we showed just previously was a very radical transformation. I mean, it looked like somebody and their grandmother. I mean, that much of a difference.
Right.
If the skin is older, it's just not going to have that pliancy on its own.
As a general rule, the older we get, the less elasticity our skin gets. But you know, some women or some people who are very, very young have loose skin. That's just genetic. And some women who are older have tight skin and lose weight and do well.
It goes back on its own.
Right.
How about bone structure?
Well, you know, we all have necks that we like or don't like, and we're all shaped differently. So, you know, the procedure has to be modified depending on what the patient looks like. A patient with a fuller neck, like I have, would need a different procedure than somebody who's very thin, where we have to be really careful not to take too much fat out so that they don't end up with ridges and what we call a skeletonized neck, where you can kind of see too much through the skin.
We don't want a Skeletor.
No.
Now, when people come in and they ask for non-surgical modalities, can you offer that, or does it work or not?
There's not a whole lot that can be done for the neck that's non-surgical. There's a lot of work that we can do in the face that involves fillers and the use of botulinum toxin and things like that, and skin care. In the neck, if the skin is in good condition, there are some people who are using a botulinum toxin in an off-label use to try to minimize the muscle bands that can form in the front of the neck.
So we're talking about Botox, and then doesn't that kind of paralyze your voice box or your?
No, but on the long list of possible complications is difficulty swallowing, and that's kind of from that area, from treatment in that area.
If somebody asks for that, you say?
I usually don't do that, because I find that, at least in the reports that I've seen, that it doesn't make a huge difference. It's very expensive, and you should do what's going to last.
What if somebody says to you, "Hey, look, I don't have sagging. I just have, I don't have the definition that I want." Can you go in with lasers or liposuction? Liposuction
via whatever technique you choose. So I just want to clarify that laser liposuction is just using the laser to help break up the fat. It's nothing miraculous.
All right. Well, we always like to hear the latest and the greatest.
Yeah, there's a lot of advertising out there right now.
So you can do that if you just notice that somebody just has a little fullness, and they just want to have that chiseled chin.
Right. If they have a chin underneath a little bit of fullness, we can bring it out with liposuction.
And no surgery involved.
Well, liposuction is surgery. Anything that goes through the skin,
I stand corrected,
is a surgical procedure. So you want to, particularly in the area of the face, you want to be sure that the person who's doing your liposuction is certified, board certified as a plastic surgeon, and you really want to be safe and know where it's being done, because anytime you puncture the skin, you're at risk for infection, you're at risk for loss of sensation, loss of motor movement, the whole list of. So it's a small surgery, but it is a surgery, and it needs to be taken care of seriously.
And this is another one of those things, along with the slather on the sunscreen, that we can't say enough, that if you're going to go for even the smallest procedure, you've got to make sure that your physician is board certified Right. Plastic surgery. We need to take a quick break, but for more information about Dr. Lee, you can call her office at 510-704-2170 or check her out on the web at artfulsurgery.com. When we come back on Body Beautiful, we're going to be chatting about neck lift surgery and take some more of your calls.